Freestanding emergency rooms want to treat patients without emergencies, saying it could drive down the cost of a COVID-19 test.
And we reported that people are seeing extra fees on their testing bills, sometimes racking up thousands of dollars. KXAN investigator Kevin Clark explains how this effort started long before the virus hit.
Freestanding ERs are licensed and regulated by the state, and there are restrictions. Dr. Daniel Rowe practices at 2 locations in the Austin area.
We're required by law only to evaluate patients that have an emergency complaint.
In a letter to the state's Health and Human Services leadership, the Texas Association of Freestanding Emergency Rooms is asking to allow for outpatient services. That could mean getting a COVID-19 test without getting a fee that comes with seeing a doctor.
If we were able to, aside, parallel to the ER, provide just outpatient testing, whether it's coronavirus or other types of testing, we could do that at a much lower overhead and provide it at a much cheaper level.
We've been investigating the surprise billing some people are getting after taking a test. Pamela Blanc said she was billed an ER visit fee after going to a freestanding ER, among several other questionable charges. The initial bill was thousands of dollars.
Surely this cannot be for a single drive-through COVID test. They stuck a swab in my nose and it was done. How could that possibly cost $6,400?
State Representative James White has been pushing for freestanding ERs to have more autonomy even before the pandemic. He filed this bill last legislative session to allow them to perform outpatient services, but it never made it to the governor's desk.
With more entrants into the market, it would give the consumer an opportunity to benefit from lower prices and better quality.
Kevin Clark, KXAN, Investigate.
And a spokesperson with Health and Human Services could only tell us the department received the letter and is, quote, looking into the questions.